This community update was brought to you by Multicultural. A bench inscribed with "I think of you and the world is beautiful" sits in Winnipeg's Whittier Park, surrounded by growing saplings. This is the third Forest of Hope created by the Canadian Association for Suicide Prevention to promote healing, raise awareness, and foster conversations about suicide prevention. Sean Krausert, Executive Director of CASP, says the initiative aims to create spaces where communities can come together and to support each other.
Well, it started a few years ago. It was just an idea that one of our subcommittees had, and that was to plant some trees as a ceremonial situation where it could represent healing for people and be there long term in order to raise awareness about suicide prevention and obviously do something good environmentally all at the same time.
Mental health challenges in Winnipeg worsened during the COVID-19 pandemic, with a 2023 report from the Manitoba Advocate for Children and Youth showing rising suicide and drug-related deaths among young people. So far in 2024, over 32,000 calls have been answered by the Manitoba Suicide Prevention and Support Line and the 24-hour Crisis Line. Suicide prevention focuses on reducing isolation and stigma, while improving access to resources like the 988 National Crisis Line, which provides immediate assistance. CASP also offers online resources, including local mental health services, and has developed a suicide bereavement support group facilitators network, collaborating with the Center of Suicide Prevention to establish local support groups. While suicide affects all demographics, certain groups face higher risks.
In one sense, suicide does not discriminate. You have suicide happening in every demographic. However, as you point out, there are some demographics that are higher risk. And they're higher risk, I think, a lot because of the isolation that can come with being part of a particular population. You mentioned the 2S LGBTQIA plus community, and particularly trans. They are higher risk because there are some in the society that are, well, to put it gently, are not welcoming. And are judgmental, and that's isolating, and that hurts.
Krausert highlights the need for more funding, support services, and inclusive communities to address the issue.
The solution is complex. There's no magic wand that can just fix the situation. I think what you need is a lot more awareness and removing the stigma around talking about suicide. And then you need to have the proper supports in place. You need to have proper funding for mental illness, on par with the type of funding that you would get for a physical illness. You need to have greater social safety nets that provide people with a dignified living, even if they have low financial means.
CASP plans to expand its efforts in Winnipeg, offering more resources for individuals and families. The Forest of Hope is one of several initiatives aimed to create open dialogues around mental health. You're listening to U Radio, where diverse voices connect. Stay tuned for more stories and insights that matter. With U Multicultural and the Local Journalism Initiative, I'm Ryan Funk.